Thanks for joining me, Dr. Wright.
Thank you for having me.
Yeah. So you are the plastic and reconstructive surgeon here at Logan Health. I was wondering if you can just start us off with a little synopsis of what your job is.
Yeah, sure. So a little bit about my background. I was actually raised in Columbia Falls, went to college in MSU, and went to medical school at University of Washington. I found plastic surgery there. There were a couple mentors there, and I just kind of discovered the field. And it really appeals to me because you just have to think creatively to solve unique problems that different patients have. There's kind of no patient that's exactly the same, and so that part really appealed to me. I went and did residency in plastic surgery down in Salt Lake City, and then I did a one-year fellowship in microsurgery back at UW. So my job now here is very general, very broad. I have just been doing mainly reconstructive surgeries so far. I haven't dipped into the cosmetic realm yet. I may in the future. But typical reconstructions that I've been doing include breast reconstruction for patients who have cancer and require mastectomy or lumpectomy to treat the cancer. We do lower extremity reconstruction, and then we'll do different facial reconstructions, usually for skin cancer or trauma.
Gotcha. So I hear you're a Sioux Falls native, is that right?
Mm-hmm. Yep.
Yeah. How did you end up back home after moving away?
I've always kind of wanted to come back. Fortunately, my wife, Josephine, was interested as well. I love the valley, and just a great place to raise kids. I like this size community.
Yeah.
My folks are still here in Columbia Falls too, which is a huge benefit.
Yeah. Is it rare to have this type of service here in the area? Like, would people normally have to go somewhere else if you weren't here?
Yeah. So the Valley offers great plastic surgery, and they have for decades. The new aspect that I bring to the table is something called microsurgery. And I'm happy to do any form of reconstruction, whether it's implant-based reconstruction for breast, but something that only I would offer in the Valley is microsurgery, which is being able to transplant tissue from one body part to a different body part on the same patient. And it's a really fun surgery. You get to intricately dissect blood vessels. You hook them up under the microscope, and you can solve some very complicated problems with this technique. I am the only microsurgeon in the state of Montana. They do offer this form of reconstruction in Bozeman, but they're bringing surgeons in from Texas to do it. So it's a great service to offer. And prior to me starting practice here, I think the patients that required it would go to places like Salt Lake City, Seattle, Washington.
That's really interesting, the microsurgery. When you were training to be a surgeon, was that something that you had a particular interest in, or was it something that was up and coming?
It's been, I think the first microsurgery cases happened in the early 70s, but the way we do it today, in terms of breast reconstruction, was popularized in the early 2000s. So it's relatively recent in the grand scheme of surgery. I kind of discovered it during residency, actually. I already knew I wanted to be a plastic surgeon. I really liked hand surgery. But then throughout training, I just saw the power of microsurgery, and I was able to be exposed to it a lot, and love it.
So I guess you probably had a lot of the same kinds of patients that you would have here, like breast reconstruction, lower extremities.
Yes. Yeah. Yep. Salt Lake City is a high volume center. Mm-hmm. They're doing probably 3 or 4 microsurgery cases a week there. Here, we'll never get to quite that volume, but we're excited to offer the service.
Yeah. So tell me a little bit about why someone might want to opt for microsurgery for like breast reconstruction rather than like implants or something like that.
Sure. Yeah, I think both forms of reconstruction are great, and some people benefit more from implants, benefit more from tissue-based reconstruction. The patients who benefit most from tissue-based reconstruction are patients who maybe they just want to avoid a foreign body in their chest. Implants can have some complications like capsular contracture, which is dense scar tissue that builds around the implant and can cause pain. If implants get infected, they usually have to come out. It's rare for a flap or a pre-flap, which was the microsurgery reconstruction. It's rare for those to get infected. And then if patients require radiation as treatment for their cancer, the flap brings like nice, healthy, non-radiated tissue into the area, and it just helps them heal.
Is there any like patient stories you can share without getting into much detail about how you've really improved somebody's quality of life? Because it seems like it would really help,
Yeah. So a lot of patients, and a lot of patients around here have gone through cancer. They've required radiation. Some of them have tried and failed implant-based reconstruction because implants fail, especially in radiated patients, fairly frequently. And a lot of them haven't wanted to travel to seek out options. So here, we've already done a few cases in patients like this, and it's patients who have kind of learned to live flat but always wanted reconstruction. Some of them have had problems with their shoulder range of motion after radiation, and being able to offer a flap to these types of patients improves their sense of wholeness and well-being, and a lot of them find that after reconstruction they can kind of put the trauma of the cancer behind them. On the other hand, a lot of patients choose to go flat and not have reconstruction. That's 100% great also for many patients.
Yeah.
So it's really it's treating the trauma and the sense of well-being of patients who desire reconstruction, and they're not candidates for implants occasionally, and the free flap is a great option for those patients.
Yeah, my boyfriend's mom had breast cancer, and that's what she opted to do.
Oh, great.
Yeah, and seems to be working out great for her. Outside of like breast reconstruction and like lower extremity reconstruction, what other kind of stuff do you run into?
So plastic surgery, you kind of need to fill holes wherever they exist. Recently, I did a case to reconstruct the top of somebody's thumb to avoid the thumb needing to be shortened. We were able to think of a nice little local flap option to reconstruct. So that's a fun case. It's really anywhere on the body that needs more tissue is kind of what we specialize in. We never really get into the bowels or the internal organs. It's usually skin, soft tissue, muscle, some bony reconstruction occasionally as well.
I just think it's fascinating the way that like the body can like mend itself like that. Do you ever find yourself just like caught up in like getting fascinated with the way skin and bones can heal like that, especially when you take it from another part of the body? Like that's really interesting.
Yeah, no, it's amazing. It's what drew me to the field. The main thing you need to heal is a good blood supply, so doing free flaps with microsurgery is bringing good blood supply to the area in addition to soft tissue to get things healed. And offering a service like this to a hospital this size empowers other surgeons to tackle problems that they might not otherwise be able to tackle. Orthopedic surgeons might be capable of fixing a bone, but if they don't have somebody to provide good soft tissue, they might have to ship those patients out. So offering that service here in the Valley keeps patients closer to home, and it's a great thing.
If someone was needing something like this, how does the referral process work? Like, who do you usually work with, I guess, for that?
The majority of my referrals come directly from Dr. Kaptanian, who's the breast cancer surgeon here. But patients who have had mastectomies elsewhere, they might get referred from their primary care provider. They could even just call and get an appointment. A lot of my referrals end up coming from other surgeons who need my help for certain things, but patients can also just reach out if they think they're a good candidate. I'm happy to talk with them about it.
Yeah. When you guys start the plastic surgery, is that how that would work as well? They would just reach out?
Yes.
Mm-hmm.
Yeah, so I think we're ramping up on being able to offer cosmetic quotes. It hasn't quite happened yet. Still fairly new to the hospital. And once that happens, yeah, they can reach out, and we're happy to discuss any form of aesthetic surgery.
Yeah. I guess just one last question for you, and it's kind of a softball one, but tell me your favorite part about your job.
I really enjoy talking with patients. I just like getting to know my patients and trying to come up with solutions for them. And I like operating.
Yeah.
I'm a big fan of operating.
Cool. Well, thank you so much, Dr. Wright, for doing this.
Yeah, absolutely. Thanks so much for having me.